Okay, now we are on module 4. And this module is why is there so much confusion with treating back pain? It is a $1 billion business, and yet it doesn't seem to be getting any better with people getting back pain resolved. And so we're going to be talking about why there's so much confusion and what is happening, and why people aren't getting better, which is leading them down to surgery after surgery or feeling like they just have to live with this pain because there's nothing else that they can do. And I'm here to tell you that it is possible to get back and feel better. So, the four major categories with treatments, major problems with treatments is basically treating the wrong category. So, remember the five categories that we talked about up front. You've got to address which category that you're in. So, if you don't figure out that first part of it, you're going to be treating a symptom. So you've got to understand, is it really chemical? Is it mechanical? Is there emotional component? Is there an autoimmune component? These are things that you have to address. Again, like I say to people, like where the side of the pain is often not where the source of the problem's coming from. Now, we talked about all the three different categories, and a lot of times you can be in multiple categories. So there may be some issues in your ribs that's creating some of your back pain, but it also maybe it started with your back to begin with, and you have to address that as well as address the ribs. Or, like I say, I swear it's probably 90% of the time when we treat back pain and we get that resolution, we also go into the hip because the hip on the same side of the pain is also not moving. And if we can get everything moving, then you are going to feel a whole lot better and it will stick, and be a lasting type solution for you. So the other another problem is only looking at the injury in one way. So what do I mean by that? So a lot of times you go to PT and they want to strengthen or they want to stretch. You've got to work on your core strength, which if you look at the research on core strengthening and improving core strength when you have back pain, it's not great. It does not work. You've got to get to the source of the problem before you can even strengthen the back. And so that's the problem. So if they're going right after you're going to a physical therapist and the first thing they want to do is, okay, we've got to work on strengthening and you have back pain, man, I would say, nope, I'm going to go and go somewhere else. Or if you say that, we've got to stretch your back, we're going to bring your knees into your chest and we're going to bring your knees side to side and we're going to do a hamstring stretch and we're going to do a figure 4 stretch, I would run because you're just stretching the symptoms. Like I said before, the tissue is a symptom. We've got to get to why is the tissue tightening up to begin with. And so if you start noticing all these things, then you definitely want to make sure that you find a different healthcare provider because they're not going to really be able to help you. Now, massage, again, we go and get a massage. They only look at the soft tissue piece of it. So again, if the soft tissue is a symptom, you've got to get to why is it tightening up, and you will basically get frustrated because your pain will come back. Now you're going to feel much better and you'll be like, at least I got some relief. That's going to be great, but let's go and figure out why the tissue's tightening up so we can get you lasting relief because that's what we want. Chiropractor, they only look at the joints. So yeah, that's great. But are they only looking at the joints at the side of the pain? Or are they just cracking and going? What we find in our office is that when you've had something for a really long time, you've had back pain for a while, joints stiffen up and it's going to be really hard to manipulate them. A lot of times, what we tell patients is we've got to stretch the joint. We've got to get the joint to start moving. And when we do, everything starts moving. We've even had chiropractors going, I can't even manipulate you, but they come to our office. We start getting things moving. We're showing you joint stretches that you can do. And all of a sudden, they're like, I can get a pop now. Where I couldn't before. It was like next to impossible. And that's what we're talking about is you've got to look at the joints. And a lot of times when we teach you how to stretch and the joints in the way that's going to be helpful for your body, and we do that stretch repeatedly, it has the same effect as a manipulation, but you're able to get it. And that's what we love. So again, you can't only look at the joints, and we've got to look at multiple areas, not just where the side of the pain is. Got to look at the thoracic spine, got to look at the back, got to look at the hip. They're all connected. Doctors only look at you from a drug perspective or from a surgery perspective. Like they can't help you any other way. So that's what they're going to look at is, oh, let's put you on drugs or let's do surgery. We have clients that often say that physical therapy is not going to work with some doctors. And to their to tell you kind of what's going on a little bit is that they probably have sent them to places that were really bad that only worked on core strengthening. And they do believe that physical therapy really can't help them. But when you get to a place that really understands it, it's magic. It's like you want to continue to go to those places because they're going to be able to help you navigate your body way better and getting you back to feeling great and getting your life back. Mixed messages. Core strengthening. These are common things that we see. Oh, your core's not strong enough. That's why your back hurts. Well, if you go and you do the finger analogy and you pull your finger back, it doesn't matter how strong your fingers are. If you keep on pulling your finger back, you're still going to have a problem. So we've got to get to the source of why it's happening, what you're doing throughout your day that's creating some of your problems. Otherwise, you're going to continue to have pain. Same thing with massage. Oh, your tissues are tight. Let's just do some massage and that'll make you feel better, which great. If it does, then the tissue was the problem, but more times than not, the tissue is a symptom. And if your pain comes back, it's just another thing that you can say like, oh, I'm not getting to the source. I need to find someone that's going to be able to help me. Stretching, my muscles are tight, so I just need to stretch. I need to bring my knees to my chest. I need to bring my legs side to side. That doesn't always work. You're just stretching the symptom of the tightness. And then losing weight. That's another thing that we'll hear from people is like, if I lose weight, then your back pain's going to go away. True for knees, not necessarily for the back. There's no research showing you that losing weight is actually going to help you with your back pain. Now, if you have knee pain, absolutely, it will definitely help. And I can tell you the majority of the people that come into our office are not overweight when they have back pain. They still have back pain. And we've even had clients that said they lost weight and their back pain didn't get any better. And I'm like, I know the research doesn't really show that back pain has anything to do with losing weight. And really, no one gets into what you're doing daily that is creating the problem. No one's getting into your lifestyle of what are you doing throughout the day that might be creating the problem. If sitting is an issue and you have a sitting job and that's giving you some problems, we've got to come up with a game plan. There's things that we can put behind our back to give us better support. We can do standing desks. We can take calls and walk around. There's a lot of different options that we have for people to help them understand what they're doing that's creating some of the problem. If it's gardening, we'll give them some tools and different things that they can do so they can continue to do the things that they love once when they start feeling better. And they have an understanding of why it's happening. And that's what you have to get into. And if you don't get into some of these areas of what you're doing daily, you will continue to have a problem. It's similar to if I keep on pulling my finger back, doesn't matter how much massage, how much exercises, how many joint moves I do. If I don't fix why I'm getting there to begin with, then you're always going to continue to have problems. So, what are the treatment steps? And a lot of times, what I find is people will look at they'll do steps in the wrong order essentially. And so really what we look at the very beginning is we look at mobility. You've got to check how the joints move and we need to look at it above and below where the pain is. So we've got to look at, how does the back move? How does the thoracic spine move? How does the hip move in all different directions? And we passively move people and sometimes actively move people into some of these positions so we can see, are there differences from side to side? If there is, that's a problem. You've got to address it. And so this is where you've got to improve the mobility in order to get to some of the strengthening pieces of it. If you can't move, it doesn't matter what you do. It doesn't matter how you strengthen or move because you're going to be moving around an area. If you physically can't move there, you're not going to physically be able to get some of the muscles to fire. And so that's why going into just the stability piece of it is the wrong next step. You've got to look at mobility. So then once when everything is moving, then you can look at stability. So then you're looking at what's the muscle weakness and what are some of the tightness that's happened because it's been there for so long. So if you get all the joints moving correctly, then we've got to start addressing some of the weakness and some of the patterns that happen because of the weakness. And if you don't get out of those patterns, that joint will go and tighten right back up again. So we find a lot of things where, people have issues, their back muscles are actually weak, but they physically couldn't move there because their back couldn't move very well, or their hip muscles were very weak because they physically couldn't move their hip into hip extension. So it wasn't allowing certain muscles to fire and they were compensating in other muscles. Now, if you keep on compensating because of the weakness, then that, guess what? That back will tighten up, that hip will tighten up, and then you'll be right back in that same place. So again, that's where the stability, the muscle weakness comes into play. We start working at the muscle from that individual piece of it, and then we get into more of the movement patterns, that third phase, the functional strength, and fix the movement patterns to get you moving correctly. So you're not going around something or using a muscle that is weak and you're going around that area. So we've got to look at those functional movement patterns. And then the last phase is really guiding you back into your activities that you want to do safely. Because if you haven't been doing something in a while, we've got to slowly build you up to having a tissue tolerance to those activities. So those are the four treatment steps that we do. And if you miss one of them, or you do any pieces of these out of order, you'll be missing part of the boat. And that's why some people feel like nothing is working for them.